Welcome to all our members watching this webinar, which is a joint webinar with the Royal College of Psychiatrists Wales and Royal College of Psychiatrists in Scotland, called Making an Impact. I'm Dr. Trudy Senavaratna and I'm Registrar of the Royal College of Psychiatrists. I'm absolutely delighted to introduce this webinar with colleagues from Scotland and Wales. It's a great opportunity during a challenging time to reflect on work that the college is undertaking in our devolved nations to improve outcomes for our patients by shaping policy and working directly with our membership. In each of the devolved nations of Northern Ireland, Wales and Scotland, the college has dedicated teams doing excellent work to represent and support members. This includes, but is not limited to, informing policy and legislation, developing national workforce and recruitment campaigns, shaping and developing partnerships with other mental health organisations, supporting the full range of faculties to regularly meet and share best practice, keeping close communication with the membership, offering full events and academic programmes, and latterly corresponding to COVID and the unique demands of each devolved nations. We hope this webinar can be informative to all our members on the positive work being done to advocate for parity of esteem and to ensure the voice of the Welsh and Scottish membership shapes mental health policy in their respective countries. This comes ahead of critical elections in both nations, with Northern Ireland's election taking place next year. With mental health featuring in policy debates to a greater extent than ever before, our members' voices must be heard loudly so that the needs of the people with severe mental illness are prioritised. To do that, we have Aidan, Reid and Liz Williams, the policy officers in Scotland and Wales respectively, on hand to talk to us through the work going on in both nations to enable members to positively influence the legislative agenda. We also want to provide a perspective on what it is like to contribute to the college's policy work, whether it be through consultations, attending committees and roundtables, and meeting directly with senior members of the government and the opposition. Our two guest speakers have sat on either side of the table with regards to engaging and being engaged. Dr. Clementine Maddock, as Vice Chair of the Royal College of Psychiatrists Wales, will speak to what it's like to engage as a member based on her numerous engagements with Welsh Government and the Welsh Parliament's Health, Social Care and Sport Committee. As a former Minister in the Scottish Government and senior academic, Dr. Richard Simpson will speak to what ministers, civil servants and parliamentarians are hoping to get out of engagements with our members. We hope their perspective can aid your efforts as a member to advocate on behalf of the college. We also hope that detailing how your individual engagement can translate into real change will act as an encouragement to take available opportunities, particularly through our faculty, to add your voice to the chorus of members on the key issues that matter to your specialty. We'll now go to our first speaker, who is Aidan Reid, who is our policy officer in Scotland. Following advocacy and political monitoring work with some of Scotland's largest organisations, Aidan came to the college during the height of the COVID-19 pandemic. He has been able to positively contribute throughout the pandemic to the college's engagement work with policymakers around the key issues emerging for those with mental illness and learning disabilities. He will speak to the work going on in Scotland and the college's No Wrong Door agenda for change. Thank you very much, Aidan. Handing over to you.
Thank you very much, Trudy, and thank you very much to all the speakers who've taken the time out this morning to cover some of these issues. I suppose just to start is just to almost consider the why, and why an organisation like the college would want to put out a manifesto around an election. And I think it's fundamentally because the political parties are doing it, and The political parties ahead of any election will try to set out their vision for the country, but they'll also go into detail on what that vision will actually translate into, and that includes into mental health and to how that mental health care is provided. So that provides a really important and fundamental opportunity for the college to engage with political parties to offer positive policy solutions that they can adopt within that manifesto that we can then hold them to for the next 5 years within the parliamentary life cycle. But it also allows for an opportunity to extensively engage and to raise our voice, to raise our importance as an actor in the political sphere, and to also change the terms of the debate around mental health, ideally to shift it from not just being about population mental health and well-being, as important as that is, but to move it also to take account of those with severe mental health to whom we provide care to, and the needs and their needs as well. It's also about being able to take an opportunity to shift the public and media perception around an election debate as well. That's an important opportunity, and to raise public awareness for those around those with mental health and the care that is provided to them. So with all that being said, this was a quite odd process, conducted entirely virtually, understandably. Nonetheless, we had extensive member engagement around what a policy priority should be. We saw over 50 detailed written submissions. We saw a college-wide member survey within Scotland. We also had over 20 online consultations. And the key themes that emerged from that was that while the pandemic had created new needs for mental health care and support, it also exacerbated pre-existing issues with the care that was being provided. In particular around access, our members repeatedly reported that, particularly for those with severe mental health, they reported going through multiple channels to be referred to the right professional service, but experienced delays in being seen. And then for that appointment to then translate in them being told that they had the wrong sort or wrong type of mental health, and to then almost have to start from go in terms of trying to access that support. And then also in terms of travelling many miles to accessing that care, because Scotland's quite a remote and rural country. So from those challenges, we came up with a core vision as to what we wanted to see in each of the political parties' manifestos, which was that there should be no wrong door to accessing the right mental health care in the right place and at the right time. And we didn't want to just offer a problem. We didn't want to offer a vague vision of a solution. We also wanted to offer concrete and positive decisions that could be made to move us towards that goal. So that included a multidisciplinary mental health workforce plan that allows for planning and mapping out between the community and the specialist then to allow for the needs that's being seen in the staff that's available, so that each of those services can act concurrently. Also looking in terms of resourcing, Scotland is has a lower percentage of the funding going to mental health than either England or Wales at 8.2%, and we wanted to see each party commit to moving that to 10% by the end of the next Parliament. And then we also looked at some of the gaps around access, and that included looking at transitions for our young people from CAM through to general adult, and that was why we called for a national transition strategy focused on our most vulnerable young people. So those are just three of the 16 key policies that we put forward following that member engagement, and then we went out to engage with the political parties. We engaged with each of them, and there's key spokespeople, the manifesto writers. We then launched the manifesto itself, receiving national coverage, highlighting some of our asks, and we've continued to highlight our asks whenever a relevant news story has been coming up. And we also extensively and positively engaged around the recent Scottish budget process after highlighting the necessity for mental health to receive greater resourcing in this budget as well as in future budgets. In terms of the kind of results, it's been very positive thus far. While we haven't seen the final manifestos from each of the parties, they're already starting to espouse some of the policy priorities that we've highlighted to them. We've also seen a much greater profile for the college. We're seen as a group, we're seen as an organisation that people will now proactively go to seek input. And also around the budget, following our engagement around the budget process, we saw the Scottish Government invest £120 million into mental health, the largest investment by any Scottish Government since devolution began. But that's not just all that we do. We've also had a number of positive successes in other areas doing the day job, whether it be leading engagement with the Scott Review into Mental Health Law and securing the college a really positive role in that, whether it be around being the key clinical voice around the minimum unit pricing for alcohol, which is one of the most significant policies any Scottish Government has undertaken, or whether it be quite literally the afternoon after this webinar is recorded, the announcement of a workforce specialist service for clinicians seeking specialist mental health care and support. But I thought it was just worth closing by saying that all these positive developments are the result of the input that we get from our members, whether it be through responding to consultations, whether it be through highlighting key issues to your faculty, whether it be through responding to college-wide member surveys. All of that then feeds in and allows us to have a really positive voice and to advocate for on key issues like a workforce specialist service and have a really positive impact. So I just wanted to close by thanking all the members who inputted into our manifesto process and to highlight that this is the kind of level, this is the success that we get when we operate as a collective member body. Thank you very much.
Thank you, Aidan, for that really informative presentation on the work that's going on in Scotland. And it's really very positive to hear how much work is going on to address mental ill health and the role that you and the college and members have been able to play in steering and informing all this work. So thank you very much. Next, we have our Wales Policy Officer, Liz Williams, who joined the college in November from the leading suicide prevention charity, Samaritans. Since joining the college, Liz has led on the college in Wales engagement with key policy stakeholders, including the Minister for Mental Health and Wellbeing, and has enabled the membership to have its voice heard on key policy and public affairs developments. She will speak to some of those engagements, as well as College in Wales' own manifesto, which calls for parity between mental and physical health services to secure the best possible outcomes for people with mental ill health and learning disabilities. Thank you, Liz. Over to you.
Thank you so much for the introduction, Trudy, and I'm so pleased to be here to talk about our approach to our political engagement work in Wales. I'd really like to focus on how our work in policy supports and is influenced by our membership. This is so important. We've achieved so much over the last 12 months through close collaboration with our members. This has made a huge difference, particularly in responding to the pandemic. As many of you will know, in May there will be a Welsh Parliament election. And since early last year, we have engaged with politicians to influence their party manifestos and to shape their wider agenda around mental health policy. We launched our own manifesto, which sets out calls to the next Welsh Government at the earliest opportunity, with the aim of political parties taking our recommendations on board. I'm now going to give you an overview of the key themes and recommendations set out in our manifesto document. It's worth mentioning that members played a crucial role in shaping our manifesto recommendations, and they're able to provide evidence and propose ideas through our exec committee and through faculties. The overarching theme of our manifesto is the need for parity between mental and physical health services, with access to the right services in the right place and communities working together to reduce poor mental health. It is essential to the college that those who suffer from mental illness or who have a learning disability or both receive the same quality of care and same access to services as they would if they had a physical illness, and that services are equally funded. We believe that this is the only way to create a Wales with excellent secondary mental health services, delivering positive outcomes for patients with mental illness and intellectual disabilities. We have engaged with all major political parties over the last 12 months, through individual meetings and by attending designated conferences and roundtable discussions to ensure they understood our recommendations and would hopefully adopt them in their own plans for government. We've covered every base and have seen our recommendations discussed or raised as questions in Parliament. One party has also already notified us that our manifesto heavily influenced their own, and we were so pleased about this. We also have really benefited from having shared priorities with other medical colleges, third sector organisations and stakeholders. Having a shared agenda can amplify our voice and help share our recommendations with a wider audience. We also continue to work with the current government across the mental health portfolio, and there have been a number of policy developments that we've been able to engage with. This is the final year of the Welsh Government's long-term strategy for mental health, and our political engagement around this led to a number of our recommendations being adopted within the current government term. We have also received a clear commitment from Welsh Government around some of our other recommendations. These include extending unique nurse staffing level legislation to inpatient settings, funding our partnership with Diverse Cymru to extend the cultural competency framework, which is currently in every health board in Wales, confirmation of the Mother and Baby Unit in spring 2021, implementation of new standards for prison mental health in partnership with the college, a commitment to a long-term mental health workforce plan, which will be launched this year with funding to deliver upon this vision, which is something we successfully lobbied for. There are many more, but I won't detail those in this talk. As mentioned earlier, a lot has happened in the last 12 months since we launched our manifesto. However, we are continuing to develop our policy priorities in response to the pandemic, and this has been member-led. We are currently developing a COVID recovery document and will be issuing this as a monthly briefing to the Welsh Government. The document will set out practical recommendations around securing the best outcomes for people with mental illness and learning disabilities as we emerge from the pandemic. This document has drawn on evidence and findings from our member survey and from views of faculties across the college. This isn't a static document, as COVID and its impact is a moving picture, so this will enable us to have regular contact with the Welsh Government and with senior officials. We take great pride in how we deliver our work, as we rely on our membership to provide us with the most up-to-date advice and evidence. One example that shines through is that in 2019, we endorsed a small research project in CAMS for video consultation and telehealth, with a view to support a gradual expansion of this service. The project Kutch, driven by Professor Alka Ahuja, informed the whole of the NHS and social care response to COVID, establishing a new department in government to oversee the rollout of video consultation and telehealth right across Wales. It was genuinely exciting to see psychiatry at the centre of the government's response. We also really benefit from where members represent the college and advocate on our behalf, and Dr. Clementine Maddock will be able to talk about this in more detail shortly. We encourage and support members to provide expert evidence for college responses to consultations, inquiries, and to share their clinical knowledge in stakeholder meetings. Part of our role is that members receive the skills and the confidence to support our policy and public affairs work, and we do this by providing written and oral briefings and by sharing the most up-to-date policy documents with them. If you want to read any of the documents that I've referenced in this talk, you can find our COVID recovery document, our manifesto, and our highlights document on our website, and please do get in touch if you have any questions. Thank you very much, and I'll hand back to you, Trudy.
Thank you so much, Liz, for an incredibly positive and comprehensive overview of what you and your colleagues in the Wales office have achieved. It's great to hear how you've ensured the expertise of our members is translating into positive transformation in mental health. Our next speaker is Dr. Clementine Maddock. As Vice Chair of the Royal College of Psychiatrists in Wales, she is also the UK College's Specialist Advisor on Mental Health and Mental Capacity Law, and was a key advisor on the independent review of the Mental Health Act in 2018. She will speak to her experiences of what it is like to represent the college, including in the Welsh Parliament and at Welsh Government meetings. Thank you so much, Clem. Over to you.
Thanks ever so much. Thanks, Aidan. Thank you very much for the opportunity to speak today, Trudy and team. And if I could have the first slide, please. So I'm going to be talking about representing the Royal College of Psychiatrists, in particular recent experience representing the college in Wales. And I've had the experience and the opportunity to give evidence to committees and policymakers, and I'll be talking about three key steps. Number one, finding out the members' views in order to produce a written evidence and define the college's position. Secondly, preparing for the meeting, and thirdly, the meeting itself. To the Health Committee, the Welsh Government set up a number of committees to inquire into the effects of the COVID pandemic on the people of Wales. So prior to the committee meeting, Ollie, Liz and the team produced written evidence following two member surveys which were carried out during the pandemic to find out how psychiatrists, psychiatric services and patients had been impacted. And this formed the basis of a comprehensive written submission produced by the RCPsych Wales policy team. So giving oral evidence, I'm sure there's no right or wrong way, but this is what I did. So I think the first thing is do your homework. Find out who is on the committee, what are their backgrounds and expertise. In Wales, which is bilingual, and committees can give, members can give evidence in either Welsh or English, find out if the committee members perhaps are speaking Welsh or English as a first language. I'm learning Welsh, and I generally tend to start in Welsh, saying that sadly I'm not fluent in Welsh to speak fully in Welsh, but I hope to be in the future. And I think it's also important to find out each member's title and form of address. I think there's nothing more embarrassing if one uses the incorrect title. The second aim, I think, is really to try and establish rapport at those initial meetings. Have an opening sentence ready and smiling appropriately, because this is an exercise in communication, just as in any other meeting. So in terms of giving the oral evidence to Health Committee, I think it's very important to identify what is your core message and what is the evidence. Our role is to present information in a way that is clearly understandable and presents the message which advocates for our patients. So in particular, as a college in Wales, we were concerned about the impact of COVID and the response to COVID, which has created known risk factors for serious mental illness and suicide, in particular social isolation, economic hardship, and untreated physical and mental health problems. I think it's also helpful to have a phrase which will somehow describe the conditions or the message you're trying to get across. So I think we used the phrase, you know, this is creating a perfect storm of mental illness. It certainly has the potential to create that. The other, I think, key in oral evidence is to tell a story. It's really important to give details, and certainly when the report came out, a number of the anecdotal reports of how people had been impacted via video links were presented in the report. So, for example, I'd heard about the case of a woman in an abusive relationship who was unable to see her psychologist via Zoom as she had no safe space while being in isolation with the abuser. I think it's also important if we're presenting a problem, because usually we are asking for more resources, that we also present a solution. And what I noted from the committee was that people wanted to know, okay, what are the short, medium and long-term solutions? So it might be helpful to think about that and also to be very specific in what you want, rather than just, we need more resources. What resources do you need? Why do you need them? What is the evidence for that? So, for example, there was the problem of inadequate space for outpatient clinics, which were preventing both physical and mental health problems being untreated. So one solution was to use the Nightingale hospitals, which were at that time empty, for socially distanced outpatient clinics. The other issue was that there was a lack of adequate data on A&E admissions for self-harm, but anecdotally, liaison psychiatrists had seen a massive rise, and one of the recommendations of the committee was that this data should be collected. So medium and long term really goes into our plan for increased retention and recruitment into psychiatry. So medium is filling all our training posts in psychiatry within Wales, which will then go into our long-term plan of increased consultant psychiatrist posts and capacity within Wales. Meeting with policymakers, very similar. I think the preparation for the meetings is important. Really, it's really important to determine what is your main aim for this meeting, what is the outcome that you want, what are the key messages you want to get across, and I would suggest there should be no more than 3, preferably 1. If this is the first meeting, then I think I go back to my medical school communication and learning training, which was RICE, establish rapport and find out the other person's ideas, concerns and expectations. And I think it's also very helpful to think, how can we assist you? Because policymakers will have different objectives to us. We probably want the same goals in the end, but there will be different means about achieving them. And I think so then it's really helpful perhaps to allow your own objectives to arise naturally in the conversation when you're given an opportunity to do so, and listen as much as possible, because that's really helpful. If this is the first meeting and there are going to be future meetings, I think it's a really good opportunity to find out actually what are the priorities for this minister, for this policymaker. How can we assist them in achieving that, which is also the best way of helping our patients. And I think thanking and acknowledging that they have given the time, their busy time up for the meeting is also really useful. So thank you very much for all the team in Wales for all their support throughout this process, and the Central College. Thank you very much, Trudy.
That's brilliant, Clem. Thank you so much for providing us with such a helpful overview of engaging on behalf of the college. It's great to hear what you've been able to accomplish through your efforts, and for the ways in which to engage with the Health and Social Care and Sport Committee in Wales. Thank you very much. And last but by no means least, we have Dr. Richard Simpson. As one of the first members of Scottish Parliament elected to Scottish Parliament, Richard served in the Scottish Government as a Deputy Minister for Justice. Between 2007 and 2016, he also served as Shadow Public Health Minister for Scottish Labour, as well as sitting on the Parliament's Health and Sport Committee. With all his experience of listening to organisations like ourselves, input to policy development, he will speak to what it is policymakers are hoping to get out of such engagements. Thank you so much, Richard, for joining us.
If I can start by just saying that I think what Clem was saying was totally valid, and many of the points she made I will be actually trying to reinforce. As you said, Trudy, I served 13 years in 2 spells. In the first spell, I acted as a reporter to the Health and Sport Committee and I actually did 3 reports. One on how the health service consults, which completely changed how we consult in Scotland. One on organ donation, which is about to be legislated on now, where I recommended presumed consent. And the third one was actually on pandemics, which was quite topical. As you said, I was a Minister for Justice and not Health, and that actually is fairly typical. That when you're appointed as a minister, you're often appointed to an area in which you haven't had massive previous experience. And indeed, my appointment as Deputy Minister of Justice was exactly because of that. They felt I was too close to the health portfolio. I did also serve between 2003 and 2007 on the UK College Parliamentary Liaison Committee. And that committee was successful in scuppering attempts by the Home Office, who were at that time seemed to be in charge of creating a new mental health law, which is now only being addressed by after the Wellesley report. I make the point about the ministerial appointment to be justice to underline the fact that the minister is rarely an expert in his field. For example, in the Labour government, 3 terms at Westminster, there were 8 different health ministers. The exception in Scotland was Ross Finney, who served 8 years as an Environment and Rural Development Minister, but that's pretty rare. Moreover, the civil servants, we should remember, also move around departments every 3 years ago. That's a hangover from the days of empire, when they trained in all aspects in order to be able to govern in a colony. So if it's only the civil servants are present, they may also have little knowledge. However, quite often, certainly in ministerial meetings, there will be imported or seconded experts in health, people like the Chief Medical Officer, Nursing Officer, Pharmaceutical Officer or Dental Officer, and often too a psychiatric advisor in respect of mental health. And these people are more experts. So I think the first point I would make is it's important, if you can, to assess who is present and their likely knowledge of mental health, because that's critical in exactly how you're going to pitch your message. My experience as a minister is that we had 3 types of meetings. One would be seeking advice from experts on a problem. In Scotland, for example, we had a review of the Tayside mental health services, which had real problems, and there the minister would actually ask for advice from the college on exactly what was happening. The second is seeking support for a policy initiative that the minister is about to promote. And the third is to listen to proposals that the college might have. In all cases, these meetings will be attended by civil servants, and they will have briefed the minister beforehand. Sometimes in the meeting we'll pass him notes and keep a record of, and they will certainly keep a record of proceedings, at least in most cases. Where you're making a pitch, the ministers are always happy to listen, but you should remember that they're unlikely to make any commitment, although you can come away with the impression of such a commitment. At best, the minister will be supportive and agree to raise the issue with colleagues. If they're a junior minister, they're especially careful about making a commitment on behalf of their cabinet secretary to a policy proposal that you're making. So the key point, as Clem said, is to be very focused, have a single priority, or maybe two, or maybe three, but two is probably best, and in order to represent a really clear ask, because otherwise I think it'll get lost. The second is, it can be worthwhile providing prior evidence. This often happens with committees, but you can do it also in meetings with the minister. And for all these pieces of evidence, it's very important that it should be free of jargon and free of what I call initialese, which bedevils work. I remember when I took over as Justice, reading the initial papers was extremely difficult because all the initials were different from those that I'd been used to in health. The policy officer will help with your input and make sure that there is clarity. When you're meeting backbenchers, you need to first of all determine, are they government party or opposition? And is the meeting at your request or at yours? If it's the government and the government MSP and the current government, they may be quietly sounding you out for the government in order to test your position before the government goes public. If in opposition, they may be seeking to recruit the organisation to a campaign or to a viewpoint. So that's something that you need to be quite careful about. Of course, if it's on your behalf, you may wish to promote or persuade MSPs about a policy or about a possible amendment to a draft or stage 2 or 1 or 2 legislation. Certainly that's the way it operates in Scotland. If you have support from other users, from users and third sector or other organisations, such as in Scotland, the Law Society, or you can quote from NGOs, this makes your presentation much more powerful. And indeed, with a minority government, such as we have in Scotland at present, that is more likely to succeed. The press release, for example, from the Scottish division from the Scottish Mental Health Partnership, which the college supports, and was put out the other day, was a particularly powerful example of how to exert a collective pressure. But this is much less likely to succeed if it's a majority government, as we had in the 2011 to 2016 term. My key points on this are that, first of all, if you don't know the answer, and just as in committee, don't bluster. This happens when they asked for data, which is not in your submission. You really just should say, I don't have the exact data to hand, but I'll provide this to the committee or the minister or the MSP afterwards in writing. And that's a perfectly permissible way to approach it. The questioning of professionals by the minister or backbenchers or indeed in committee is usually pretty respectful, unless there's a suspicion of poor practice, and especially if there's been any covering up. The NHS Tayside inquiry was quite difficult because there were real problems there. Another example in Scotland was when NHS Lothian gamed their waiting times, and that was something which they got under pretty heavy attack. If I make one more suggestion, in the run-up to the election, which is about to occur in both Scotland and Wales, inviting all candidates to sign up to a very short pledge, preferably called by a strong group of stakeholders, is a good way to increase awareness and add pressure within each party. There are also likely to be virtual hustings this year, and it would be useful for college members appropriately briefed to attend those and ask a question or make a point, because that again would raise awareness with potential future MSPs or Welsh Assembly members. In summary, It's vital to be very clear about the purpose of your meeting. It's important to be fully briefed by your policy officer. It's important also not to obfuscate. Stay focused, stay clear, offer clarity of any further material in writing, and involve stakeholders, as many as you can, on your side. I think those are the important points. I would make one final comment. As President Roosevelt said to a senator who had presented a proposal to him which he rather liked, but he said, "Now that's fine, go and get the public to convince me," because it's the public at the end that can often swing what a government says. Thank you.
Thank you so much, Richard. That's absolutely great. And it's so interesting to hear what it's like to have organisations like the college engage you and to get an insight into what you've described are some key tips into really positively representing the college's agenda. So thank you very much. And moving on to a few questions at the end of our webinar today. Liz, can I start with you? So could you describe a piece of work that has been undertaken with the college and its membership which you think has had significant impact?
Yeah, of course. Thank you for your question, Trudy. I think I've already mentioned it, but I really want to highlight it again. It's the Cwtch project. And I know this has definitely been a highlight for the team in Wales, especially in terms of how it's evolved, how it's developed, and because the work itself was so timely and has left a really important legacy. I'd also mention the workforce plan, which we lobbied for back in 2019, and this is being launched this year. And I know technology will be a central part of it, and we are always gaining a greater knowledge and understanding of how members want to deliver the best care and undertake their work. And just to mention as well, something that I think has been a highlight is seeing the Cwtch team recognised as the Royal College and Psych Team Award of the Year, and Professor Alka Huja being awarded her MBE as well. It's just brilliant to see how much of a difference that's made and how we've been a part as a team of developing that in the earlier stages.
That's lovely, Liz. Thank you so much. Next, I have a question for you, Clem. Can you tell us what is the best piece of advice you could give to a member representing the college in a meeting with policymakers?
Thanks, Trudy. I think I would go back to the 3 Ps: preparation, policy, and personable. So prepare, know your audience, know who you're speaking to. Policy, make sure that you have an agreed policy with your members. Ideally, if you can have a partnership, as Richard said, with other key stakeholders and ensure that you're in line with the public, this will be more powerful. And personable, I think it's really important when we have the opportunity to meet key policy makers that we are able to establish a positive working relationship. Thank you.
And Richard, you've already given us some wonderful insights already. But can you tell us, what do you find is the most valuable means of influencing the legislative agenda available to groups like the college?
I think that's a hard one, because there are so many different groups out there who are pressing their own material on the ministers. I mean, the MSPs in this election, standing for this election in May, and in Wales, the MAs, we're bombarded by different manifestos. So brevity, clarity are really the 2 really important things, but also the partnership, because if you can get as many organizations on your side supporting what you're trying to do, then it's much more likely to influence the politicians. I think I would add one more thing, and that is that the politicians are influenced by what's going on in the media. And if there are issues in the media that are occurring, then they can sometimes provide an opportunity to time the intervention with the minister or with the committee in an effective way. But the important thing is to really try to just maintain links as best you can, both with the government party, but also with the opposition, because they can have an influence, particularly in Wales and Scotland, where there's a greater likelihood of minority governments.
That's lovely, Richard. Thank you so much. And lastly, Aidan, a question for you. I wanted to know, how can members get more engaged in policy activities?
Thank you, Trudy. I suppose in terms of further engagement, I mean, there's always going to be an element of, I think the ideal is through your faculty, is raising issues within the faculty, as being a positive and proactive member within that, because within that body is the ability to raise issues that have been seen in the local areas, and to identify potential national trends that then need to be raised. Even if it is local though, there's also the opportunity to engage directly on behalf of the faculty with regards to whether it be a health board or it be a trust in the English context. It's also just, even if it is just 5 minutes responding to a member survey, that data can be so valuable and critical in the arguments that we make, because it is really, this is something I said at the end of my presentation, but your individual voices as a collective is incredibly powerful. When we presented data recently on, even just from our own child and adolescent faculty members, and a survey response, that the amount of traction that has had with policymakers and the influence that's had, you know, in terms of already in terms of that £120 million that I've previously referenced, around 30 to 40 million pounds of that is likely to be invested in CAMHS, and that's partly as a result of the ability of that, that's the willingness of that faculty to be able to advocate positively on behalf of the children and young people to whom they provide care to. So I think it's just seeing the opportunities that come through, working within your faculty, and yeah, if you've got the time to be able to more extensively input, whether it be a workshop in response to a policy consultation, then yeah, we're absolutely happy. We're always going to be willing to try and take member enthusiasm and to try and utilise that in the best and positive manner possible. So yeah, those are just some of the things, but yeah, it's just, if you want to be a more proactive member, please feel free to get in touch as well directly with myself and Liz.
That's brilliant, Aidan. Thank you so much. So we've come to the end of our webinar. I just wanted to thank all our speakers today for making fantastic contributions to today's discussions. We really hope that you as members have appreciated the insights each speaker has been able to offer, and that you'll finish this webinar feeling energised on what you might be able to do and contribute as part of the college to positively change mental health policy. Thank you very much.